carers for sickle cell disease patients in the future. The call also goes out to people who may know that they have someone in their family line or among their relatives who has or has had sickle cell disease. It is really very prudent that those ones check early. But even those without any such knowledge, it is important that they check, because when someone is a carrier, they will live a normal life on the outside. They really live a normal life like someone who is not a carrier and may never know until they get a child with sickle cell disease.
So now, how do we manage or treat somebody who has sickle cell disease or sickle cell anemia? Since we know there is no cure, so how do we help them?
So treatment of sickle cell anemia, sickle cell disease is really around the complications that they get. We want to prevent the complications, but if they come, we want to manage them. So let us first start with prevention. Those patients with sickle cell disease, we want them to not have stress. And stress is not just psychological, but even stress of medical condition, medical stress. For example, dehydration. Dehydration is a stress to the body. We also do not want them to have stress from even sometimes school. That causes a lot of stress on their bodies. If there's really a lot of intense pressure and even caning, children go to school in fear, that stress alone weakens the body. So they should be well hydrated and they should avoid stress. Cold weather is another stress for people with sickle cell disease, so they should be kept warm as much as is possible. So we also know that they have anemia, so we want to prevent them from having very low blood levels. We give them supplements for blood. And when we give supplements, we specifically avoid those which have iron, because they already have a lot of iron due to broken down red blood cells. So in prevention, we deal with that. And then in
maybe I can add on in prevention. So she has mentioned something very important, that the problem with sickle cell anemia or disease people, their red blood cell breaks down quickly. Instead of maybe taking 120 days, it takes a shorter time and breaks down, maybe 1 month or so. So you have to avoid them becoming anemic or losing much blood. Now, in addition to what she has mentioned about stress, we should also give them foods that help their red blood cells to stay a bit stable. So there are foods which we call, they contain antioxidants. Antioxidants are substances that help the cells not to become stressed or for their shape to become rigid easily. So those foods are, the simplest way to understand them are colored foods. Any food which has color, beetroot, booger, malakwang, carrots, they are very useful foods for those people to always take. Can be taken as juice or can be taken as food regularly. So they have enough antioxidants in their body to stabilize the red blood cells, so that it takes a bit longer to break down. So you want to talk about management?
Yes, management in sickle cell. Usually we are managing complications that they get. So we want to manage dehydration, we want to manage low blood levels, which we are called anemia, we want to manage infections. So many times they may need blood transfusion, and after the blood transfusion, we also give the tablets that we have said for increasing blood production. Always remember, they should not contain iron. Then, when we are managing the dehydration, we give fluids. These fluids help to reduce the pain, because when they go into the blood system, they reduce the clogging of those red blood cells. Then the patient's pain goes down. We also give them painkillers to help with pain, and oftentimes a combination if the pain is severe. We want to also manage infection. You check what are the likely infections through using lab tests and also clinical knowledge, and you treat accordingly. So there are common infections they get malaria very often, and we also get bacterial infections very often, so we manage those. After treating malaria, you also give them anti-malarials to take regularly, so that they can reduce the frequency of getting malaria. That is a lot around management.
So that is the management in terms of conventional medicine or modern medicine approach. Now, in addition to what she has mentioned, there is also a drug which is now recommended to those children, for those people. It's called hydroxyurea. It helps to boost fetal hemoglobin for young people, which carries blood better than the sickle hemoglobin. But at Jena Herbals Limited, we've also been doing research for many years on how best to improve treatment of sickle cell disease or sickle cell anemia. So we developed a medicine which we call Jena SM. Jena SM, Jena is the name of the company, SM is sickle cell, and then M is for malaria. In other words, meant to tackle sickling of the red blood cells and also malaria in these people. So how does Jena SM work? First of all, what's Jena SM? Jena SM is made from plants, medicinal plants in Uganda here. Those plants, we have studied them, they are safe, and they are also able to reduce sickling of red blood cells. So they reduce red blood cells from sickling, so they remain normal shape, and they don't easily break down. Secondly, they also boost HB, hemoglobin levels in these people, so try to increase the blood level. And also they help to reduce clogging, like you mentioned about clogging, the blood cells sticking together. It improves blood flow or blood fluidity, which improves oxygen carriage to the different parts of the body. So Jena SM is not a cure, but it helps a person live normal life. When a person takes it, the red blood cells don't easily sickle, and therefore they live healthy lives. Now, how does one use Jena SM? The dose for Jena SM is meant to be taken once a day. Depending on the age, if the child below 5 years, 5 days. A child between 6 and 12, 10 meals. Above 12 years, 15 to 20 meals once a day. Now, usually we recommend that you take it once, a person takes once a day for at least 2 weeks. That helps the red blood cells to stabilize, and then one can try to adjust to once a week, because some people do well with once a week as well. Other people need it every day. So depending on the response, you can adjust to once a week or continue to give every day, just once a day. Now, a number of people who use this Jena SM don't develop anemia. I know more than 100 children have followed for the last 15 years. Hardly has any gotten to hospital for transfusion. They may get pain here and there, but don't get blood transfusion. Meaning that their blood remains fairly normal. And then we also recommend giving them immune booster. As she has mentioned that their immunity is weak, they get infections frequently. So if one combines Jena SM and Genamal, because Genamal is meant to boost immunity against malaria and other infections, the children or the people using it live much better lives. Now, we wanted to know if you can use Jena SM plus other medicines she has mentioned Yes, you can combine genesem with the painkillers in case the person has pain, or with hydroxyurea, there's no problem. You can do it together. Does genesem cure? No, it doesn't cure completely, it doesn't cure, but it helps you live a normal life. What are the side effects of genesem? It's very rare to find side effects of genesem because they make them from plants which some of them use as food like avocado. But sometimes some people may get rash because it contains honey, so they react to the honey and you get the rash. So normally it's rash and a little bit of maybe diarrhea, but not common really. It's relatively a safe medicine for anybody to take. For how long should you take genesem? Because it does not cure, it's like a lifelong treatment. So you are most likely to take it until when a cure is discovered. Some people have taken it for 15 years, 20 years, and they're okay. They are living well. So many people call and say, I've given for 3 months, can I stop? No, you are not going to stop because it doesn't cure. But you can monitor the person and see that they can take once a week, or sometimes they may miss, but ensure that the medicine is there for them to use. Now, some people have also asked me, can I use genesem to prevent getting a child with sickle cell if I'm already having others with sickle cell? Right now we don't have data to show that if you take genesem in pregnancy, you can get a child without what? Sickle cell. So we can say we are not sure whether it does or it does not. Yeah. So where do you find genesem? Genesem is found in pharmacies and drug shops all over Uganda. You can go to a pharmacy, a drug shop, or a clinic and ask for medicine called genesem. We'll explain to you much better and also tell you how to use it. Thank you.
So thank you for listening to us. For those who have questions and want to know more about sickle cell disease and genesem, please leave your questions in the comment section below and we are going to respond to them.
I call upon all of you who are listening or watching to support Jena Herbals Limited because we are committed to doing research and developing natural medicines that help us now and in the future. Thank you very much.